Good afternoon. Today I'm going to talk to you about the role of thrombolytics with a special focus on tenecteplase in the management of myocardial infarction. We know that acute myocardial infarction is one of the most severe forms of coronary artery disease. Over a period of time, there have been several other lytics which have come into the market, which have come in our use. Important ones being retiplase and now tenecteplase. We need to understand what exactly are we looking for in a good thrombolytic agent. We look for an agent which is easy to administer, that is, it should ideally be a bolus dose lytic. We need a lytic which should be fibrin specific, which means that it should lyse the clot in the coronary artery and should not damage the fibrin elsewhere. It should have lower side effects in the form of intracranial bleeding or bleeding elsewhere. We also need that it should have a great efficacy and a large number of patients if they undergo an angiography after getting tenecteplase, and we should ideally have a TIMI-3 flow. We know from our experience of streptokinase that does not happen, and final TIMI-3 flow is achieved in less than 29% of the patients. We also know that this percentage increases a little bit in the case of alteplase. But it is actually with tenecteplase that you get a much higher incidence of a TIMI-3 flow, which translates into a greater survival. So you've got a drug which is safe, which is a very effective thrombolytic agent. In fact, my hospital is one of the single largest users of tenecteplase, and we've had used extensively. We use it up to several hundred patients every year, and in one of the unpublished data that I can share with you, we had a TIMI-3 flow of close to 90%. It was like 89% had a TIMI-3 flow with resolution of the ST segment, and this was across the board. Patients who presented quite early and patients who presented up to 12 hours. So a very good drug, very successful drug, and I think as long as possible one should use tenecteplase in preference over all thrombolytic agents. Thank you.